Hello, everyone. We're Doctors Eric and Wanda Thomas,
Hello.
and we are going to give you some up to date information about the novel coronavirus, COVID-19.
Yes. So there's been 120,000 confirmed cases. There's been 4,000 deaths, and the mortality rate is about 4%.
So, around the world, as you can see, there's a large number of cases that are being reported. I'm in here currently in the United States. We have a little bit over 1,000 confirmed cases. We have 29 confirmed deaths, and we do have a confirmed case in the New Orleans area. So we know that the virus is spreading both globally and nationally. So it will be in our area soon.
Yes. It usually affects males greater than females. The age is between 20 to 75. Elderly are the most affected, and it may occur in clusters in a family cluster, such as maybe 4 or 5 people in one family may develop symptoms.
And a lot of that lends itself to the mode of transmission. We know that nasopharyngeal droplets are the most common way that it is transmitted. So if you have a runny nose or a cough and those droplets are transferred to another person, be it handshaking, a kiss, a hug, any kind of close contact, that's the most common way that it can be transmitted. There's also stool transmission. So, we think about using the restroom and not cleaning up behind ourselves or washing our hands, which is really the most important thing that we want to stress to you today. Those are the most common ways that it's transmitted. So you can see how close family contact or people that you work closely with would be the main vectors or ways that it's transmitted.
Mm-hmm. And as I mentioned before, symptoms. One of the major symptoms is going to be fever. That's one of the approximately 80% will initially start with the fever, headache, then sore throat, then sort of shortness of breath, as well as diarrhea and pneumonia. So I want to go over the symptoms one more time. Again, fever, cough, headache, sore throat, diarrhea, and pneumonia. A person may be infected about a week before they start to demonstrate symptoms, and then they may be contagious for the next 24 to 48 hours without even knowing it once they're diagnosed.
So a lot of people ask, when you think of these common symptoms, what else could it be? So when we screen people for COVID-19, we really try to use a protocol. So the first thing that we would say to you as healthcare providers is call your doctor, call your primary care first, because going into an office with COVID-19 means that you have the potential to spread it to others. So the really best thing to do if you feel like these symptoms are related to the COVID-19 virus would be to call your healthcare provider first. Now, we understand that there are lots of other viruses out there that can mimic these symptoms, most importantly, the flu, rhinovirus, which is a common cold, adenovirus, which is another type of virus that causes the common cold. Remember that there is no current treatment protocol right now, and there is no vaccine currently on the market. So we're looking at a new virus that we're really treating symptoms. So please, if any of these symptoms are related to you or you feel that you have them, call your healthcare provider first. Those who are going to be affected most severely are going to be people who have what we call comorbid conditions. Luckily, in my patient population, we don't see a lot of children who are infected with it. And more importantly, we don't see children who are affected with the worst symptoms such as pneumonia or respiratory distress. But in Mr. Dr. Thomas's patient population, a lot of patients have comorbid conditions that may cause them to have a worse case. And what are some of those conditions?
Patients that may be immunosuppressed, such as diabetes, they may be taking steroids, or patients who are taking cancer medications. Anything that lowers the immune system would put you at risk in general. And then the other thing is, patient screening. And some of the questions that you'll be asked are: have you traveled to a geographic area within 2 weeks of you presenting with symptoms? For example, we all know about China, but there's other areas too. Or if you've been to a large venue, such as a concert, or other things where they're seeing a larger number of cases. Many conferences and events are being canceled. But we do have a case, as you mentioned, in New Orleans. We also have a case in Texas. So we're kind of, in the middle of both of those places. So hand washing, again, is going to be the primary means of protecting yourself. The antibacterial gels are good, but hand washing is the primary means of protecting yourself.
So if you go to the store and you don't see any hand sanitizer, reach for the soap, use water. At least 20 seconds of good hand washing is going to do just as good a job as using a hand sanitizer. When we meet and greet at church, oftentimes we like to hug. We're the peaceful church where the spirit meets the soul. We like to give each other a kiss. Let's consider some other means of close contact for greeting. If you feel that someone may be infected with the virus, or you feel that you want to protect yourself even more, understanding that this is a virus, and as more information becomes available, we will share it with you using common sense. If you feel that you're not at your best, we encourage you to watch online or view from our app. If you feel that you may have come in contact with someone who has this virus, we would ask that you self-quarantine or stay at home until you know if these symptoms are real.
And then I guess the last thing is, so how is it treated? One of the treatments is going to be the antivirals, similar to the flu, and I'll just give you one example, and that's a medication by the name of Kaletra. But as she mentioned, it's a novel virus, so some things they're still trying to work out. But again, hand washing and greetings may be better done as far as an elbow or fist bump, that sort of thing, while we're waiting for this to hopefully pass by.
As healthcare providers, we are given up-to-the-minute information about the virus, and as more information becomes available, please stay tuned to the app or to our website, and we will be sure to let you know what we know.
Absolutely.